pulmonary trunk is guarded by a valve, just like the aorta, guarded by a valve, all right? The valves found in the pulmonary trunk and the aorta are called the semilunar valves.
Semilunar valves?
Yes,
Okay.
they have three cusps. 1, 2, 3. 1, 2, 3. Both of them. Of course, you know that the pulmonary trunk is colored blue because it carries deoxygenated blood.
Yeah.
The aorta is colored red because it carries oil.
Once it hits the air, it turns red.
Yes.
Okay.
So oxygenated blood, all right?
Oxygenated, deoxygenated.
Yes.
And the holes were what? Were represented
For the
what?
aorta, those are the openings of your coronary arteries.
So this is stuff we need. These are the ones we need to know.
Yes. You know the chambers of the heart, you know where this comes from, the right ventricle. This from the left ventricle. The pulmonary trunk from the right ventricle.
Right ventricle, left ventricle.
And the aorta from the left ventricle.
And these are your atriums?
Yes, these two chambers here are the atria, roughly, and these are your AV valves, roughly.
AV valves?
Yes, atrioventricular valves.
Atrioventricular valves. And then over here we have the bladder, the rectum, and then the urethra.
Uterus, the womb, the uterus, and the vagina. That is the rectum also. That is the bladder also.
Okay. Well, yeah, I think I'm fine.
Okay.
And this, if you want to do 1 minute on the heart.
All right, I'll use this. The blood vessels of the heart. All right. Like we said, arising from your right ventricle. All right.
But
is your pulmonary trunk.
Pulmonary trunk. Okay,
Yes,
but we
so
don't need to know
no,
this.
no.
That's an atrium.
All right, so this is the pulmonary trunk.
Okay.
Divides into your right and left pulmonary arteries, carries deoxygenated blood, that's why it's colored blue. All right, from your left ventricle arises your aorta, all right, which has three portions, an ascending portion and an arc, and a descending portion. The ascending portion gives rise to your right and left pulmonary coronary arteries, right and left coronary arteries going to the heart. From the ascending portion, from the arc, you have three main vessels. Starting from the right, you have the brachiocephalic artery. Next to it, you have the left common carotid arteries. Next to that, you have your left subclavian artery.
And what was this right here called again?
Which one?
Oh, the right one?
This one?
Yeah.
Brachiocephalic artery.
Brachiocephalic.
Artery.
Okay.
Next to it, left common carotid.
Left common carotid.
And next to it, left subclavian artery.
Left subclavian artery.
All right, and that's in the arc of the aorta. The descending portion gives rise to so many other branches. All right. This other vessel right here, going into the right atrium, is your superior vena cava.
Superior venal cava.
Yeah. It drains blood from the head and neck.
Okay.
All right. It is formed by the union of your right and left brachiocephalic veins. On the inferior portion of the atrium, you have another big vessel, a vein colored blue. That's the inferior vena cava.
Inferior venal cava.
Yeah. All right. So the atrium receives blood from superior vena cava, inferior vena cava, and for the heart drainage, your coronary sinus.
Coronary sinus.
Yes, coronary sinus. All right.
Okay.
Okay, those two dots, or the four dots, left and right, are openings of your pulmonary veins.
Openings of the pulmonary veins.
Yes, pulmonary veins, right and left, and they carry oxygenated blood back to the left.
Okay. Oh, thank you.
Okay.